Welcome to the deep dive. You're here because you want to get a solid handle on important topics quickly, without all the jargon.
That's the idea.
And today, we're zeroing in on something really relevant if you're around dogs or cats, congenital ocular anomalies.
Right. Basically, birth differences affecting their eyes.
Think of this as your fast track to understanding the basics. We've looked at quite a few sources, veterinary info mainly, to pull out what really matters.
Exactly. Our mission here is to distill it down, what these conditions are, the impact they can have, and, what's key for you to grasp.
And it's a bigger area than you might think. These things can affect, well, any part of the eye or even the tissues around it.
And you can see them in one eye or both. Usually noticeable when they're quite young pups or kittens.
The range of specific conditions is actually pretty surprising. So let's just jump right in. What are the underlying reasons these things happen?
Well, number one is genetics. Inherited factors. The way they're inherited, though, that varies. It could be dominant, just need one gene copy, or recessive, needing two copies. Depends on the breed. Depends on the specific condition.
So mostly genes. Anything else?
Oh, yeah. It's not just genetics. You can have spontaneous malformations,
Right.
just developmental hiccups, basically. And external factors during the pregnancy can also play a part. Things like infections the mother might get, inflammation, maybe exposure to toxins.
Even nutrition.
Yeah, nutritional deficiencies in the mother. That can influence eye development, too.
Okay, so it's nature and nurture, in a way. What about specific animals? Are some more likely to get these than others?
Well, generally speaking, we tend to see these congenital eye issues more often in dogs compared to cats.
Interesting.
And within dogs, certain breeds definitely show up more often for specific anomalies because of those genetic links we talked about.
Can you give us some examples?
Sure. Take PPM, persistent pupillary membranes. They're like leftover bits from development inside the eye. In Basenji's, they're pretty common, and it's typically a dominant trait. So one parent has it, pups have a decent chance of getting it.
And other examples.
Then there's something called PHTVL, PHPV. It's a mouthful, persistent hyperplastic tunica vasculosa lentis, and persistent hyaloid vasculature.
Right.
You see that in Doberman pinschers. Also dominant, but the severity can really vary. Some dogs are barely affected, others more seriously.
Okay, so those are dominant traits. What about the recessive ones, where they need a gene from both parents?
Right. For recessive, they need two copies. Multifocal retinal dysplasia that affect how the retina develops. It's recessive in English Springer Spaniels. Collie eye anomaly, CEA, is another big one. Affects the back of the eye. It's recessive. And sadly, pretty common in collies.
I've heard of that one.
Then you've got multifocal ocular dysplasia, or MOD, in Australian Shepherds. Also recessive, but it has this thing called incomplete penetrance.
Incomplete penetrance, what's that mean?
It means, like, even if they have the genes, the condition might not fully show up, or shows up mildly. Think of it like a dimmer switch, not just on-off.
Ah, okay. Makes sense.
And Briards, they can get retinal dystrophy, which is recessive.
Hmm.
And there are other types, too, like rod cone dysplasias affecting several breeds, Collies again, Irish setters, Corgis, Slice,
Yeah, quite a list.
and cone rod dystrophy in pit bulls and dachshunds. Different genes, but similar outcomes, usually vision issues, all recessive.
That really covers a lot of dog breeds. What about cats? You said it's less common overall, but are there specific examples there?
Yeah, there are. In cats, you might see photoreceptor dysplasia problems with the light-sensing cells in the retina.
Okay.
In Abyssinians and some domestic shorthairs, it's often dominant. But interestingly, in Persians, a similar issue is usually recessive.
So the same kind of problem, but inherited differently depending on the breed.
Exactly. Genetics can be complicated.
It certainly sounds like it. It really highlights why knowing breed predispositions is so useful, whether you're, choosing a pet or working with them.
Absolutely. Awareness is key.
So moving on to what you might actually see. What are the signs we should be aware of?
Well, this is where it gets really varied. Sometimes, honestly, there are no obvious signs. It might only get picked up during a vet check.
Right.
But in other cases, yeah, it can cause pretty significant vision problems, even blindness, sometimes right from a very young age.
So what would a vet be looking for during an exam?
A whole range of things. Sometimes it's really dramatic, like anophthalmos, where the eye is just completely absent. That's rare, thankfully.
Wow.
Or microphthalmos, where one or both eyes are obviously too small.
Okay.
Then you could have issues with the eyelids. They might not have formed properly. That's called eyelidogenesis or a coloboma. The lid might just be open.
Leaving the eye exposed.
Exactly. Not good. You might also see dermoids, bits of skin with hair growing in weird places like on the cornea or conjunctiva.
Skin on the eye.
Yeah, basically. And problems with tear drainage are common too. The little drain holes, the puncta might be blocked or absent atresia or imperforate puncta.
Leading to teary eyes.
Yep, lots of tears staining down the face. And you can even have congenital dry eye KCS from birth. The eye might look smaller, maybe have thick, gooey discharge.
Okay, those are mostly things you could see on the outside. What about inside the eye?
Right, inside, those PPMs we mentioned earlier, they look like fine strands or webs across the iris, the colored part. Sometimes they stick to the lens or the cornea. You can also get iris cysts, little fluid-filled bubbles, either floating around or stuck to the iris.
Are they usually a problem?
Often not, but they can be. Then there's congenital glaucoma, high pressure inside the eye from birth. That's serious. Eye looks big, red, painful. Rare, but important.
And the pupil, can that look weird?
Definitely. You might see polychoria, more than one pupil opening. Or a chori, no pupil at all. And iridia, no iris. Or just a sliver. Or dyschoria, where the pupil is just shaped abnormally.
Lots of possibilities there. And you mentioned lens and retina issues before, linked to breeds.
Yes. Congenital cataracts, cloudy lenses from birth. They can happen alone or with other issues.
Like the PHTVL thing in Dobermans.
Exactly. That condition with the leftover blood vessels can cause cataracts. Or you might see a white reflection in the pupil leukorrhea, or sometimes a sort of reddish sheen.
And retinal dysplasia.
That's abnormal development of the retina itself. It can be mild, just little folds in the tissue, or severe, leading to detachment.
You see that in the Springers you mentioned.
Springers, Labs, many breeds actually, and Collie Anomalies specifically. The main sign there is usually choroidal hypoplasia. It's a thinning of the layer under the retina, near the optic nerve.
Okay.
In worst cases of CEA, you can get coloboma, a pit or hole in the optic nerve itself, or the retina could detach.
And the MOD in Aussies?
Right. Multifocal ocular dysplasia. That can present in lots of ways. Small eyes, maybe different colored irises.
Heterochromia.
Yes. That. Cataracts are common too. And colobomas again, but maybe in the fundus, the back wall of the eye, rather than just the optic nerve. Retinal detachment too.
It seems like colobomas and detachments pop up in a few of these.
They do. They're often consequences of the underlying developmental problem. Then you have the rod and cone problems, the dysplasias and dystrophies.
Affecting vision cells.
Right. So you might see pupils that don't react well to light and often early vision loss. Night blindness is a classic early sign, like in the Briards with retinal dystrophy. They might also have nystagmus, flickering eyes, and dilated pupils.
And if the retina actually detaches?
That's usually pretty obvious. Very dilated pupils, poor or no light reflexes, and blindness. Detachment can happen secondary to lots of these congenital issues.
One more optic nerve issues.
Yeah, optic nerve hypoplasia. The nerve is just too small, underdeveloped. That can definitely cause vision loss, potentially blindness, depending on severity.
That is quite a spectrum of signs. So with all these possibilities, how do vets figure out what's actually going on? What's the diagnostic process like?
Well, the absolute key is a really thorough ophthalmic exam, looking closely at every part of the eye.
Using special equipment.
Yes, usually an ophthalmoscope to see the back of the eye, and a slit lamp that's like a microscope for the eye to see the front structures in detail.
Okay.
Sometimes more specialized tests are needed. An ERG, electroretinogram, measures the retina's electrical response to light. Very helpful for diagnosing those retinal dystrophies and dysplasias.
Right, checking if the retina is working properly.
Exactly. And a big challenge, honestly, is telling these congenital problems apart from things that might happen early in life but aren't congenital, like infections, inflammation, maybe trauma, or even early non-congenital cataracts.
So you have to rule other stuff out.
Precisely. A good history from the owner and that meticulous exam are crucial to nail down the diagnosis.
That makes sense. So once you have a diagnosis, what happens then? What's the management like, and what's the outlook for these pets?
Management really depends on the specific problem. Often it's about treating the symptoms, or sometimes surgery is an option.
Specialist needed.
Very often, yes. Referral to a veterinary ophthalmologist is common for these cases. They have the expertise and equipment.
Right.
For animals that are blind, supportive care is huge, helping them adapt, keeping their environment safe and predictable.
And any specific treatments? Diet?
For some of the retinal degenerations, yeah, certain dietary supplements, antioxidants and things might help slow things down, but it's not a cure.
What about surgery? You mentioned eyelid issues.
Yes, things like eyelid agenesis or blocked tear ducts. Surgery is often the way to go, usually done when they're young. For congenital dry eye, sometimes there's a surgery to reroute a salivary duct to the eye.
Saliva instead of tears.
It works. Not perfect, but better than nothing. Cataract surgery is possible, too, for congenital cataracts. But you have to weigh it up. Is the vision significantly impaired? Are there other eye problems that might cause complications? Timing is important, too. It's not always straightforward.
And glaucoma. You said that was serious.
Yeah, congenital glaucoma. The prognosis is generally poor for vision. Treatment is often about managing pain and pressure. Sometimes removing the eye, enucleation, is the kindest option if it's blind and painful.
What about medications? Eye drops.
Definitely. Artificial tears are essential for any kind of dry eye. Sometimes drops are used to dilate the pupil, mydriatics, which can help vision with certain types of central cataracts.
Any medications to be careful with?
Yes, good point. The antibiotic enrofloxacin, it needs to be used very carefully in cats, especially at higher doses, as it can cause retinal damage, even blindness.
That's critical for cat owners and vets to know. So looking at the long term, what can people expect?
It really varies. Those eyelid and tear duct problems often have a good outcome with surgery. Glaucoma, as I said, poor outlook for vision.
And the retinal issues.
Progressive ones like the dystrophies usually lead to blindness eventually, but the eyes themselves might stay comfortable, which is important. For many others, it depends on the exact anomaly, how severe it is, and if there's an effective treatment.
Seems like prevention is key where possible.
Absolutely. For the hereditary conditions, responsible breeding is paramount. Using available genetic tests to screen breeding animals, avoiding breeding affected animals, or known carriers. That's crucial for reducing these issues in the future.
So it really ties back to genetics and breeding choices impacting future generations. This has been incredibly informative, really clarifying a complex topic. If you had to boil it down, what's the main takeaway for our listeners?
I'd say the key thing is that congenital ocular anomalies are diverse, often genetic, and can range from minor issues to causing blindness. Early detection through vet checks, especially if you have a predisposed breed, is vital.
And don't hesitate to seek specialist help from a veterinary ophthalmologist.
Exactly. They're the experts for these conditions.
Absolutely. And understanding this, whether you're, a pet parent or working professionally with animals, it's just so valuable for their well-being. It does make you think, doesn't it, about the wider picture. Considering how much genetics plays a role here, what are the broader ethical thoughts around animal breeding and managing these inherited health conditions? Something to ponder.
Definitely food for thought.
Well, thank you for shedding so much light on this, and thanks to all of you for joining us for this deep dive. We'll catch you next time.